Hi there, me again. Just wanted to go on with our talk about healthcare. Um, I find the subject very interesting because I'm a second year medical student, and so it's definitely going to affect me down the road. Anyhow, the thing I'd like to address today is an idea that I had for how we can reduce the cost of prescription drugs relatively soon, very efficiently, without a whole lot of investment on the front end, and definitely in a method that hopefully will, in the long run, continue to reduce our costs. So here's my idea. We have the government issue licenses to drug companies for each individual drug for them to be able to sell it in the United States. And if they want that license, then they have to agree to sell that drug for the same price in the United States as elsewhere. If they sell it at a different price, that license will be revoked. That's kind of the general outline of it. The problem is, the reason that this will help the prices is that in Canada and in many other nations which have a single payer system, they can negotiate prices far down from what we pay in the United States. There's a thing called variable cost and upfront cost when it comes to research and development and then production of pills. Upfront cost is how much you have to spend for basically the first pill. That's your research and development, your payment of scientists, that kind of thing. All those things you can't. It doesn't matter whether you sell one or whether you sell a million. That's the same price. And then there's the variable cost, which is determined by how many pills you sell. So basically the cost for the actual production of each pill. So the production of each pill, let's say that I know that I have to pay the upfront costs, but somebody offers to buy the pill at just a little bit over the variable cost. Well, I'm still making money for each one of those pills, but I'm not going to be able to make enough to pay for the upfront cost, which is basically why pharmaceuticals decide to sell to Canada and to many other nations on the cheap. It's because they're still making money, but they aren't making enough money to cover their upfront costs. They pass most of that upfront cost to the United States. And by forcing them to have the same price in the United States as in other nations, we are able to spread out that upfront cost, and that's what we're really trying to do. Now, the immediate action is that they just won't sell to other nations because Canada will be unwilling to pay this increased cost, that sort of thing. But eventually, a few years down the road, I guarantee you Canadians are going to get fed up and tired of the fact that they can't get the medicines that they need in their own country. And so they will take actions to ensure that Canada starts paying those higher prices. And the reason companies are going to decide to sell in the United States instead of just selling elsewhere is because economically it makes more sense for them. They can charge more in the United States. It also means that these drugs will probably be more expensive in the United States for the next 10, maybe 5 years, until the other countries start paying the upfront costs. But honestly, I think that that's a risk that we need to be willing to take, because of all the options on the table, I think that this is one of the lower risk, higher yield options that's available. So anyhow, just a thought. Tell me what you think.